Thank you, Mr. Speaker. And I begin by paying tribute to the staff who work in the Tyrone and Fermanagh Hospital in Omagh. And I suppose I should declare an interest, as my late father was a psychiatric nurse there. But the hospital has a well-earned reputation for the service it delivers to patients from Tyrone, Fermanagh and indeed County Londonderry. Health issues are one of the common denominators when it comes to politics. It is a leveller, and it is one thing that we, the West Tyrone MLAs, can agree on without dissent, I hope. I have to say that I feel that I am sure some of my colleagues will also touch on the fact that when it comes to cuts in health service, Omagh always seems to be the place where the axe will fall. Diverting slightly from the subject, when the issues of the Lagan Valley and Down hospitals came into the spotlight, I had to bite my lip, because we have gone through that entire feeling of abandonment when our hospital, the Tyrone County Hospital, was downgraded, and despite our well-organised and coordinated campaign, our pleas fell on deaf ears. So let us hope that today has a different outcome. On the 17th of October, I asked the Minister for his assessment of the future of the addiction treatment unit at the Tyrone and Fermanagh Hospital in Omagh. Naturally, the Minister did not provide an answer at the time, other than to refer me to the consultation on inpatient-based addiction treatment services, which outlines proposals for the reconfiguration of all the Tier 4 addiction services currently delivered by the trusts. He also said the consultation highlights that the present service configuration is characterised by variations in structure, role and function. It therefore sets out proposals for a more standardised and evidence-based regional model. With your permission, Mr. Speaker, it is my intention to submit the Hansard record of this debate to the consultation, which has been extended until this Friday, the 24th of January. I have concerns that someone somewhere has looked at this and for purely financial reasons has decided that the simple solution is to centralise. Let us find a hospital that can provide this service and centralise the service there. The proposal suggests the Tier 4 service should be provided at the Holywell Hospital in Antrim, 10 beds, and the Downshire Hospital, 14 beds, a total of 24 beds. I really feel that this is insufficient, and that by following these suggestions we will end up with a very poor service that cannot reflect the needs of our society. The consultation document says that within the Western Trust we do not currently have access to Tier 4 beds, but that future patients will be referred to Holywell. Within the consultation document we read, alcohol and drug misuse are major public health issues that impact on society at a variety of levels. It is estimated that approximately £680 million is spent annually in Northern Ireland to address alcohol misuse, including costs to healthcare, policing, probation and prison services, social services and as a result of work absenteeism. Drug misuse also impacts upon society, and although overall usage is low in comparison to alcohol misuse, the need to reduce drug-related harm is also a key public health priority. The advent of the so-called legal highs and the increase in sale of prescribed medication over the internet also present real challenges to society. I am going to come slightly off script here to mention legal highs. My colleagues will be well aware of the problems we have in Omagh in relation to these, and to the shop and marketplace that is selling these, despite the consequences. I have raised this issue with both the Justice and the Health Ministers, and we must keep the pressure on to stop this scourge from growing any further. These are the start, in many cases, to developing a drug habit. Our local press covered the demonstrations that were held outside the shop that sell these products, such as Magic Dragon, to highlight the concerns of the parents and our local residents. I will now return to the matter at hand. Within the consultation document, we are advised that 3/4 of the adult population drink alcohol. The proportion classified as problem drinkers is 1 in 10, and those drinking at harmful levels is 1 in 20, the latter equating to 47,000 individuals. And in 2011, there were 252 alcohol-related deaths. In relation to drug misuse, surveys show that over a quarter of the population aged between 16 and 64 had used drugs. The rate of referral for treatment trebled over the years 2001 to 2012. Over the past 5 years, the number of drug-related deaths is reported at around 30. I believe the figures illustrate a need for the retention of addiction treatment units in all parts of Northern Ireland. If Mr McElduff does not raise the issue of rural proofing during his contribution to this debate, I will be more than surprised. Clearly, Tyrone and Fermanagh are rural counties, and any indices or surveys conducted will indicate the level of availability to transport for people in these two specific counties. People need to be able to get to the facility, and I'm afraid the Antrim and Downpatrick suggestions do not, in my view, offer any positive support for people in my constituency of West Tyrone. Do you mind if I sit down, Mr. Speaker? Drug abuse is a common factor throughout the United Kingdom, and we would be foolish in the extreme to believe that it is going to reduce in the coming years. For that reason, I firmly believe that we need to retain and strengthen the provision of treatment centres within the province and in the rural West. I mentioned earlier the work of the local press, and again I will make reference to the Tyrone Constitution and the Ulster Herald. The headline in the Tyrone Constitution, "Please don't close the doors, it's our lifeline," urges Omagh and addiction treatment service users. And the Ulster Herald, "Addiction treatment unit saved my life," both on Thursday the 9th of January 2014. And I will quote from the articles to demonstrate the depth of feeling on this issue. A service user of the addiction treatment unit in Omagh has said it saved her life. I will not name the individual, but she was willing to be named in the local press. She said she had hit rock bottom when she first attended the unit in 1999. Having witnessed the positive impact the ATU has had on so many lives over its 40-year existence, she said there would be devastating consequences if it was allowed to close. She said, "I hit my rock bottom and went to my first AA meeting in July 1999. Within a week, I was in the ATU undergoing a 6-week programme. I had to go into the unit to get better. The ATU saved my life and has such a positive impact on countless people and their families over the years. I still regularly attend the weekly meetings, which are really well attended, and is a great support network to so many, and will be really badly missed if it is allowed to go." I will also go off script again slightly for a moment to pay tribute to Ramona House, which provides a great service to those with drink-related problems. I and many of my colleagues have been actively encouraged to visit this facility and meet the residents, and I can only congratulate the staff and the residents for what they do and how they and former residents help hold a lot of people together during very trying times. And I am sure many of my colleagues in all of the constituencies would concur that we have, on a regular basis, to help individuals and families with drink-related problems. In the Tyrone Constitution, we see the following comment. My opinion is that instead of closing addiction and treatment services, we should be expanding them, because there is a great influx of teenagers coming into addiction services, and we need to be ready for them. I will repeat, there is a great influx of teenagers coming into addiction services, and we need to be ready for them. That chilling comment should be enough for us all to sit up and pay attention and take action. I continue with the quote. Right at this moment, as you're reading this, some parent is holding a baby that might just need the addiction treatment unit in years to come. If that does not send a chill down your spine, nothing will. We have to have a reality check, and we have to accept that the scourge of drug taking and addiction to alcohol will not go away. We have to ensure that should this become an epidemic, that we as a society can cope and provide support. The staff at the Tyrone and Omagh Hospital in Omagh are professionals. Their ability to deliver a service is outstanding. We in West Tyrone have become cynics because it always appears that should a service need to be downgraded or removed, Omagh will always appear on the radar. We have had promises, we have had assurances, and we've seen all these possibilities crumble to dust. The threat to remove other mental health services is still hanging over Omagh, with the suggestion they should be removed to the new South West Area Hospital, despite promises and assurances given by many health ministers. We now have a situation where, in planning for the future, we can ensure there is a service in the West and based in Omagh, and that is my hope for the future of the Addiction Treatment Unit at Omagh. Thank you, Mr. Speaker.